This is about the wanders, about the wizard. It is always about the wizard. It is always about the doctor. How they're using that technology to provide better care for our patient. Unequivocally, the most accurate, producible, and reproducible solution to be able to place dental implants is with robotics.
Hey, everybody. Welcome to the Dental Handoff. Today, I have with me a person who is, man, and he's like nailing jello to a tree. I'm so glad that I have you, Dr. Jay Neugarten. Jay, thank you so much for your time. He's on a staycation, and I got an hour of his time. Thank you so much for being on today.
Kelly, thank you. Certainly look forward. This has been a long time coming, and look forward to the opportunity to just talk with you and spend this next hour going through the journey.
Yeah, you guys, you're gonna be in awe about all the things that he does that he thinks that are everyday things that are just like, it's just part of what I do. He's like Superman. So Jay, why dentistry for you? Like, how did you get drawn into
Yeah,
just
yeah,
dentistry? And then tell us the story. I know you'll tell us the story beyond that and how you
yeah.
went where you are.
So I love this story, and thank you so much for asking me this question because it really started with my mother and father, and it started in the deep roots of my family. I'm first generation. My parents came over during the war, and I tell this story when I lecture. So this is great opening. My parents coming over during the wartime, they didn't have good dental care, and my father, who was a butcher, took over his dad's store, literally. And there was my brother, my sister, and my mom. And dentistry in Europe, as you can imagine, during the 30s and 40s was incredibly poor. There was none. And it became a motive for my dad where teeth became very important to him because he was about to lose all of them. And he met an individual, an icon in the world of perio by the name of Bert Langer, who I thank every day for the ability to be a dentist as I am. And started at home with my mother and father, really, really focusing on teeth. And we had a local dentist. And in high school, the high school had like a program where you would do like spend a day with a professional, whether it was a stockbroker or someone in the financial or a woodworking or an electrician. And I chose a dentist. And I spent a day with our local dentist at the time, and through that and the inspiration from my mother and father, dentistry became such a inspiration for us to begin. And from there, the journey began. And so my journey from there went through Boston University was where I went to undergrad. And I really wanted to be a NASA doc. Like this was in the time of Star Wars and Reagan was the president. And that whole expand for space. And I started out as this aerospace engineer. I wanted to be like a space dentist and a space doc. And at Boston University, all of a sudden, I'm like, all right, this is a pipe dream. This is not reality because really my passion is medicine and dentistry. And I wanted to go on that journey. And I left aerospace engineering because I knew I was not going to be the next frontier of NASA doc. And I went into exercise physiology at Boston University, which kind of got me set up to go to dentistry. And I went to dentistry at Columbia University. And what's interesting, and there's so many funny stories that come out of this. My dad was a butcher, as I said, and it was just literally a mom and pop operation. And every Christmas, Thanksgiving, Easter, I would go and help and support. He worked overnight. He had, enough orders that he needed the help. So we would go and support the family business. And I always wanted to cut the meat, and I got the hand. No, you're not touching the meat. You're not touching the meat. So as I went through my professional career and I got out of dentistry, the answer was still no while I was in dentistry. And my first days of Columbia University Dental School is when I knew I wanted to be a surgeon, between the inspiration from my dad and that whole world and my mom, and then from just the anatomy and the people that I met, I knew that I wanted to be a max face surgeon. And from there, I then went on to Long Island Jewish in Long Island, and I met one of my major mentors, Steve Sachs. And in my journey through my residency, I still continue to help my dad. And once I became an oral surgeon resident, he was like, okay, you can cut now the fillets and the pork and the crown roast and the lamb chops.
That's all it took. That's all it
Uh,
took.
it's all it took. And then, but it gets, because all of a sudden the customer would come in and the first time, like I did a fillet and I put all the rope on it and the bacon on top of it and everything else. My dad turns to the customer and he says, "Oh, your fillet was butchered by a surgeon." And I'm like, "Dad, you can't say that. Like, that's not." Yeah, butchered by a surgeon. That kind of like oxymoron doesn't really work.
I know. I was like, that didn't sound good at all.
Yeah. So then I finished LIJ, and that's how I got into the world of dentistry. It really started at home.
Wow. Yeah. So your dad's love for wanting to cure this condition for himself and understanding there could be a better way of life for people because of his own condition. And then it attracted you on a career day. On a career
Totally,
day is,
for
is
sure.
what it was. And then
That's what it
you
was.
guys, for those of you all who don't know who Dr. J. Neugarten is, okay, I know that you're a very humble human being, but you are a world-renowned surgeon, oral maxillofacial, zygomatic implants, everything. And I would argue that you are the NASA surgeon. I mean, you get to use robots all the time with what you do. How did that not come to fruition? You are that. Come on.
Thank you. Thank
You
you.
really are.
I'm
So
humbled. I'm
I
humbled.
mean, you have your own. Okay, I'm jumping way ahead, but like when I met you for the first time, I felt like we had been best friends forever.
I
And
agree with that.
Jay is he's the person who wants to know how your dog is before he knows like anything else. You just really connect with people. And that's what I think that resonates with audiences around you, with your patients, with your teams that surround you to make everything that you do possible to support you because, we're only the end of one, right? In our lives. So on from where you went to dental school, I know that you said that you sort of have like this aha of like, I knew that I wanted to be a surgeon. How did you get into the specialty and the specialties that you're in now based on where that time frame took you?
I think a lot of that has to do with the path and the people that I surrounded myself with. And I think that really teamwork makes the dream work, really. And I was very fortunate in my life to be touched by so many amazing clinicians. The practice that I joined in Stephen Sachs, who I really thank every day, and I tell my residents, find mentors, find people who are going to inspire you, find people that are going to raise your bar, because you're not going to get there alone. And the world of surgery is hard. The world of dentistry is hard. The world of medicine is hard. But having people who have been there before so that you don't have to reinvent the wheel is so critical. Now, take what they have and grow it. Take what they have and spin it up, but you need to have a solid foundation. And for me, it's really about the people that I have come across with in my career, Stephen Sachs, Michael Schwartz, Sal Ruggiero, who are all in my practice now. And we really have a group of 7 clinicians we're in private practice and we do tertiary care within that space. And part of the going across the aisle to the medicine, to ENT, to plastics, to periodontist, to orthodontist. And what we do is taking care of patients, I think, is the biggest gift. It is the biggest gift that we have, that somebody is going to allow you to take care of their inner core and what they do, whether it's teeth, whether it's the jaw, whether it's the abdomen or the brain or the heart. I mean, we sometimes lose sight of where we are and what we've had to do to get where we are,
Totally.
that really, it's really just so special that we can be that aspect. And we get one opportunity at this thing called life. And how do you want to live it? What do you want to do with your life? How do you want to be? There's an equalizer across all of us called time. It doesn't matter who you are. It doesn't matter where you are socioeconomically. It doesn't matter where you are in this paradigm. We only have so much time in our life. And how do you want to spend it? How do you want to do it? And it is really important that we make sure, for me, that I can utilize as much of that time to enjoy. And I think the world of oral maxillofacial surgery, we are the luckiest people in the specialty, whether it's in the medicine specialty or the dentistry specialty. I think we have the best discipline within the world of being able to help patients because we live on both sides. It starts right in the mouth where you chew, you tear, you speak, aesthetically, right? What do people look at? They look at the teeth, they look at the facial structure, right? I'm not looking at your toes or your hands first line. That might be someone's other pathway, but the
Right.
face, the face is where it's at. And we are at the beginning of the whole piece. And that's why I think we're just the luckiest organization to be able to manage this part of the as clinicians to be able to manage our patients.
I love that perspective. I have a couple of best friends who are oral maxillofacial surgeons, and I think that they may agree with what I'm getting ready to say, is that many OMFSs have a lot of ego. Like, the more specialized you get, the more ego sometimes there is to cut through among specialists. Would you say that that could be your, I mean, maybe not in your group, but in your experience, you've probably seen some of that. And I think that once they're, because you're expected to be so exact and precise and to have the answer to every single thing that's in front of you, Jay, that how would you recommend, because I'm thinking about the new student, right? The new person who is emerging into your profession or who's growing or looking for that mentor, and they're thinking, man, I should already know all this. How do they reach out, get outside of their own head and reach out to that mentor to say, I need help. I don't know
Just
what to do.
ask. Ask. We are humans. We've been where they've been. And listen, I think that the world of egos within any discipline, it's a fine line. I will tell you, people have said that I've had that. And I try to be the most humbling person I can. And it's a fine line because we live on the precipice of being, as you just said, we got to be exact. We have to be able to deliver. We have to be able, and that also can be misunderstood. And one of the things that I tell people on my tombstone, it's going to say constantly misunderstood, because I think it's not a matter of there are people that have egos, there's no doubt. But I think it's also that sometimes a level of confidence can be misconstrued as that. And then as I'm talking to the youth at trying to humble them and bring them down, you want your surgeon to have a level of confidence, because you don't want your surgeon to go into surgery feeling not comfortable and confident about what they're going to be doing. You don't want to be overzealous. You don't want to be, that level. But I think that that's where sometimes it's a fine line between calling someone that they have an ego versus confidence in what they're going to do. And I talk to a lot of young clinicians, and one of my inner core and the way that I approach care, and I want everybody to approach care, is to make believe every patient you're going to take care of, you're taking care of your mother. Because everyone wants to take great care of their mother. And if you treat every patient like it's your mother, then you're going to provide the best quality of care. And when I talk to the youth and they say, "Oh, is that good enough?" My answer to them is, "All right, your mother just had open heart surgery. Your mother just had an implant placed. Your mother just had neurosurgeon. And you're sitting there as your son or your daughter of your mother, and the surgeon comes out and says, 'Look, I took care of your mom and the surgery was good enough.' How does that make you feel?"
Mm.
No, 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 no. You are given a gift, the gift that people give you to take care of them. You and I tell my residents one thing, remember, you chose this profession. You chose this. And you need to do everything in your power to take care of your patients to the highest level, like your mother, that when you look at it, not only did you take care of them with empathy and care and passion, and everyone is nervous. Nobody likes to go to the dentist. Even dentists don't like going to the dentist, and
True.
breaking down the anxiety and putting your arm around them and telling them that it's going to be okay. And we're not perfect. Sometimes we make mistakes. It's okay. And to be comfortable in your skin, to be able to do a lot of that is so important for the youth today, to be able to manage our patients to the highest level. And the good enough is just got to get taken out.
Yeah, that's where mentors come in, and you get out of your own way and you go, ugh, I need help. I need insight. I'm curious as to how I can get better to give this case, to prep for this case the best that I can. And and that's what I wanted to get at, because I feel like that's also a part of what you're saying with mentoring, because it's easy to say in theory, oh, just go find a mentor. But sometimes we're in our own imposter syndrome where it's hard to even know to go grab a mentor,
Uh,
you know,
yeah,
who to
yeah.
go to. So that's why
Yeah.
it's like, okay, how do people even say, okay, I don't want people to know that I don't know that.
Haha, it's funny you say that. I mean, that's another whole story that I could tell you. I had somebody that came and I taught particular surgeries, and they were on my social media, and all of a sudden I get an email that says, or a phone call that says, you got to take it down. And I'm like, I thought there was some mischief or something like that that had happened. The long of the story was they did not want other people and their patients to know that they had someone that they had gotten help from a mentor. So it's exactly what you're talking about. Yeah, it's exactly what mouth dropping, like exactly. And I was just talking to my senior partner who's giving grand rounds at one of the local hospitals, and we're talking about three things that really the youth should be inspired about, right? Caring, because if you care, you can change the world. Care, you can change the world. Number two is get involved. Get involved with multidisciplinary environment because you might not know who you connect with, right? Get involved with societies, get involved with organizations that you can get access to. I mean, in your residency, you have access to clinicians that are mentors around you. But when you're out in the big wide world, you don't have some of those, but you can get into organizations to be able to meet other people like your organization and what you're trying to grow and come across people.
Right.
Right? And then number three, which is mentorship, right? Those are the three pillars, right? Be involved and organized to meet people, really, care and have mentorship because that will really elevate the clinician's ability. We don't have all the answers. And to be able to look across the aisle and grab that help is so important.
Yeah. Well, it means something coming from different peoples in different walks of life too. I think to we can learn from people who are when we least expect it, right? When we don't even think that they could help us, but it's that ability to open up and say, I need help or I need some insight.
Yeah, it's kind of like that aha moment, right? It's aha. And it's okay to ask for help. We don't have to feel like we're isolated and live in a vacuum. And there's nothing wrong with it.
Yeah, absolutely. So when you went on and you're becoming who you are in your profession. Now you have your own surgery center. You're doing zygomatic implants. You're doing these intense, life-changing surgeries every day. And you have a social media following that is brilliant, by the way. You guys, if you don't if you don't follow him, the things that you say and that you do and the coffee that you drink is just you gotta follow Dr. Jane Neugarten. You are hilarious. It's I just yeah, a day in the life of you on it. But tell us about what your day to day is like, Jay, now, based on like
Yeah.
where you were and like what you're doing every day.
So, and I, my life I think has been an evolution, not a revolution, right? When I finished, I've been doing this now for 25, 26 years. And we've evolved to this point. And again, I think that this has been a growth and development to be able to get to the point and transform where we were to where we are today. And I think a lot of it is really seated in technology and how technology allows clinicians to take care of patients better, right? And when I first got out of my residency, how we were using a Handoff articulator, we were using sticky wax, and we did not have three-dimensional X-rays. We did not have a cone beam CT.
Right.
And right, and that we all of a sudden evolved to a cone beam CT and three-dimensional treatment planning and intraoral scanning. And that's where getting involved gives you access to this technology. And technology is not for everybody. There are certainly plenty of technologies that come out and that go by the wayside. But as and not every technology works in everyone's hands. And that technology for me in the orthognathic space between cone beam CT, three-dimensional treatment planning, intraoral scanning has evolved to what we call PSP or a patient specific platform, which really talks about patient specific implants, the customization of that world, right?
Mhm.
Within the orthognathic space, right? And then in the implant space, we went from freehand, we went to certain guides, and then we evolved into really prosthetically derived treatment plans, and we started to really understand the relationship between restorative and surgeons and getting better, and soft tissue and hard tissue management and manipulation and the biologics and all these things that we have. And all this innovative solutions allowed us to be able to take care of our patients better, to the point then when we get into guides and we get into stackable guides, and then we evolve into the next frontier, which is robotics and haptics and that piece. So which I know we'll spend some time, but the way that my career has gone has been looking to take care of patients better. Don't get complacent. Looking to get better solutions, looking to take care of our patients better. And one of the things I also talk about are bullseyes. What's your bullseye? Everybody has their bullseye of what they want for outcome for care, whether it's on the restorative side, orthodontic side, endodontic side, whether it's on the oral surgery side. Where do I want that implant? And do I do a post-treatment assessment of was I able to accomplish and get that? And if I'm not, how do I get the bullseye that I want, right? Because patients come with a certain bullseye. And in the world of social media today, and in the world of AI, and in the world of communication, they're all talking. So they're trying to develop what they want, and they're trying to figure out who their team is going to be. And the technology is clearly here today, and being able to get a better outcome for our patients is really what this is all about. And that's what's driven me, that we can break down barriers, make patients more access to care, get patients less fear, right? No one likes going to the dentist. How do we make that experience better so that we can have the highest quality of care for our patients, so that when they leave your office, they're speaking your praises? Because that word of mouth is better than any social media campaign, any Instagram post, any Google review. When they're out and they're talking about Dr. So-and-so, he is the best. That is what we strive and thrive for our patients, to be able to get there through solutions today.
Absolutely. I agree with you. And the way how much technology evolves just in 30 days is crazy.
Crazy.
Then I know that it can be very intimidating
Mm.
for a lot of people because I mean, shoot, ChatGPT and Claude, they change what they look at every single day. None of us can keep up with it. It's exhausting. So when you talk about robotics, Jay, and you're talking about like the predictability and the happiness and the success that hitting the bullseye for your patients, tell us about what you do when you're using these robotics. Is it only for oral surgeons, or who is using this?
Yeah, so it is an FDA-approved device, company called Neosis, that has this device called the Yomi. It is the only FDA-approved robotic device in the US. It is open to restorative dentists, periodontists, oral surgeons, whatever discipline of dentistry that is currently wants to place implants. And it is going to change, and it has changed already, the way that we deliver care. And I think that if you look across the aisle to our medical counterparts, there is not an area of medicine that does not have some robotic world within it. And it's not like R2D2 is coming in here and the patient is being handoff and going to get a robot, which some patients think. And I'm like, it's not that. It helps to augment and make our predictability, our accuracy, and our reproducibility better, right? Where we don't operate in a vacuum, we can kind of see the problems before they go there. And what it allows me is I can do smaller flaps, which means less swelling and less pain. I'm able to do more involved movements. I'm able to take what you can't see and make it visible on the platform. And this solution I've been using now for 6 years, and it has transformed the way that I deliver care. I have my patients who want to come in for it. It is a impactful, growing, innovative solution within the dental space. I firmly feel that it will be branching out into other disciplines of dentistry, between making a crown prep, veneers, orthodontics, endo. It will be in all of those disciplines of dentistry in time as the brilliant minds of the engineering world utilizing AI and technology that this will be able to deliver care better for our patients. Do I think we're going to be replaced by these? I do not. That I don't see, but I see it going to be able to help and augment and really strategize. And the other, one of the sayings I say, this is about the wander is about the wizard, right? It is always about the wizard. It is always about the doctor, but how they're using that technology to provide better care for our patients. And unequivocally, the most accurate, reproducible, and reproducible and reproducible solution that's there to be able to place dental implants is with robotics using Yomi. I mean, that's out there in the literature. That's been proven.
Yeah, because I'm thinking too with, I mean, with medicine, they've been doing things with like the Da Vinci and
Yeah, exactly.
how long has that been out? That's just a that is the standard of care with
Correct.
robotics. I remember the first time I heard about it, I was thinking like it was like
Yeah, R2D2. Yeah,
yeah,
yes.
and like treating appendicitis or doing a heart surgery or whatever it is. So it's
Yeah,
become a standard. And when I think about just rolling it back, Jay, to because I'm a hygienist, and so when we roll it back to shoving a stainless steel probe in the gums to see if there's bleeding, and how caveman like that is, just to see that, and how archaic it has been, the way that it's grown in order for us to serve that predictability. I mean, because we can only control our environment and like all of the things that surround what it is that you're doing. What we can't control is the inflammation in the patient's body and their systemic reaction to whatever things they're putting in their body or whatever that is. But as long as you can control your outcome as best as you can to minimize the healing, the swelling, the the support that the body has to render to heal that individual, especially if they have delayed wound healing, so you can do the minimally invasive incision if needed. I'm just thinking
correct.
about all these
Yeah.
things about. I know I just kind of riffed, but my mind is going, and that how standardized robotics has been in everyday medicine.
Completely. I mean, you hit the nail on the head, and if you think about the Mako, which was an orthopedic device that is used for knees and hips, that is what the Yomi comes from. It is from that platform, from Mako, that is what brought the Yomi to light, and it's an offshoot of that, and I think that the runway and the pathway for robotics in the world of dentistry, we are in the first inning. I don't even think we have any outs yet in terms of how long this game is gonna be and the impact that this will have in the space and place of dentistry is going to be monumental. I really feel that the world of dentistry is just at the beginning and the precipice in the robotic world.
So you have because I know you're all, oral maxillofacial surgeon. So what I'm thinking about the everyday dentist who's watching this or listening to this, and they're thinking, I don't know if this pertains to me. Maybe I just refer out to the oral surgeon. How can the everyday dentist or the person who's practicing implants in their practice do this for themselves? Is it a matter of extensive training? How easy is not saying it's technique sensitive, I know, but like what is it like to be able to use this device?
Yeah. So if you're somebody who places a number of implants on a year and you're looking to become more, you use guides or you use freehands, you use stackables, or you use augmented freehand, right? There's augmented freehand companies that are out there that are using camera based for implant placement. You have freehand and then you have guides, but you want to take your implant practice to another level. I would highly consider this device because it's not about today, it's about where this is gonna be going tomorrow, and it's early on, and it allows you for smaller flaps, bone leveling if you need to. The amount of bone leveling that I'm doing now is a lot less. I used to do a lot of bone leveling as an oral maxillofacial surgeon. Everyone was an FP3. Now I'm doing more FP1s than ever. I am because of the ability for robotics to get me into that space. And everyone now, I'm in a bone saving world. And yes, I do zygomas and I see these atrophic patients, and I'm seeing patients who have been transformed from all this bone is just going away. It actually cringes me as an oral maxillofacial surgeon to see that, unless we need it for the lip line or what have you. There are indications for it. I'm not an always, I'm not a never clinician. I am a diagnostic clinician that wants to look at data. I want to be able to look at what the subjective senses is, but then look at things objectively with a team, the restorative dentist, so forth and so on. So if you're a restorative dentist that wants to get on a better level in your implant dentistry, beyond freehand, beyond guides, or beyond augmented freehand, this is a solution for you. If you're liking what you have, then it's not for everybody. It is not. And it is a learning curve. This device comes in, it is a highly technological device that, again, works with a team. My team has been trained. We've been doing this for a number of years. We have clinicians that come and get trained by us. We have clinicians that want to come and watch. We have staff, your staff, that's because it involves your staff. It has made me more effective, more efficient, because it's to the point now where when I see a patient, everything's already done. My team has the day of scan, has the array, has all the technical stuff done. So when I come in, I give local and I go. And that's where we are at this point. Now, it has taken time. This is not just a one-off piece, but again, with the company, and it's not, it's bigger than that. It's not just about that. I think it's about a team, restorative. So if you're a restorative dentist, a periodontist, an oral maxillofacial surgeon who wants to be better outcomes, who wants to provide better care, who's looking for better solutions, it's something to consider, but it is not for everybody. Some people say, I'm not looking to change. Okay, it's not. And I speak to a lot of clinicians, and someone says, well, I want to go from 1,000 to 2,000 implants and the robotic is going to get me. No, that's not what this is about. This is about getting better outcomes, better predictability. You'll grow to that, or you can grow to that if you want. Yes, there's the whole marketing piece and stuff, but that's an accessory to me. I think it's about taking care of patients better, breaking down barriers, and getting better results is where the world of robotics lives for me. And I think it's for a lot of clinicians across many specialties.
Yeah, that's profound. It's y- I don't even know what to say. I mean, you do so many different things, and that takes a lot to say that, but you do so many things with this device. I could go like 20 different directions. Tell people what you speak about. So you've been speaking for a while, and I know that you
Yeah,
speak
yeah,
about the misadventures of implants and
yeah,
knowing when to refer, knowing when to say, oh, that's probably not what
yeah.
I want to touch. So tell us a little bit about what you love speaking about.
Yeah. So if I give a little insight into my practice, right? So certainly I think I'm the luckiest guy in the world. I really do. And I love what I do. And I love taking care of patients. I wouldn't trade what I do for anybody, for anything. I really feel very lucky to do what I do. I'm blessed to do what I do. There are another whole airway is my airway management, where I take care of babies who are 10, 15 days old, who are struggling with airway, breathing, that need a trach or another modality or feeding. So from the airway, from the neonate up to the adult in the orthognathic world, right? So the orthognathic space in facial orthopedics, from the youth or the neonate to the adolescent to the adult, is one area. Orthognathic surgery in general, and looking at management of the face in space is another one of my components that I talk about, of how to manage and organize the face structurally from an orthopedic perspective, and the relationships between the restorative dentist, the orthodontist, the periodontist, and the multidisciplinary care that involves with these patients. Whether it's through the orthognathic space or it's through the atrophic place, where we have an atrophic maxilla or an atrophic mandible, from a single tooth, soft tissue and hard tissue management, to a full arch, whether we're doing a single arch reconstruction or a dual arch reconstruction with remote anchorage, zygomas and pterygoids, and trans sinus implants. And you being able to utilize this technology, when do we grab the certain tool in the toolbox to make it the right pathway to help our patients? These, from and the complications associated with the zygomas and the misfortunates of what we talk about, and how we handle our complications. Because certainly one of the things that I talk about is you're not defined by how you handle your successes. You're really defined by how you handle your failures. And we all have complications. We all have problems. But what are the tools in the toolbox that we can provide, I can provide you to navigate through you through that, whether from a single implant to multi implants to a multi bone graft to a sinus lift to a full arch reconstruction with zygomas or pterygoids or remote anchorage or mandible. And we talk about stackables and guides and freehand and robotics, orthognathics, and even joint replacements. How do we handle joints when we're getting into a patient who has no joints? Again, from the airway management. So there's a large breadth of what we do. And that's why I kind of coined the term management of the face in space, because it leaves it very open-ended about managing the face.
It really does. I mean, so you guys just kind of like tell him what you want to speak on and him just do it. Just space and face. I mean, see, you still put space in there, didn't you?
I got it in. I had to get my space because I think, and that's what I think has drawn me this, because we as clinicians, whether you're doing a single tooth or you're doing a full arch or you're doing dentistry or doing orthodontics, what do we manage? We manage space. Now, there happens to be something in that space, and we're using the technology to do that. So we're managing space. And how do we do that in a collaborative discussion to be able to think of the end? We want to always think of the end and then work backwards. And that's space management.
It really is. Jay, thank you. You are amazing. If you are not already following Dr. Jay Neugarten or you don't know about him, I'm dropping all his information in the show notes. He's an amazing human. And it sounds like you're on the docket to mentor hundreds of people, Dr. Neugarten.
I hope so. I want to. We have a mentorship program. I would love that. I would love to inspire, you to higher levels and take this world of dentistry to the moon.
And then tell us one more time the name of the robot that you're using.
Yeah, so it's a company called Neosis, and the device is called the Yomi. It's the second generation. It's called the Yomi S, is the one that just got released in December of 2025. It's the second generation robotic device that uses haptics, and it's been a game changer.
That's awesome. Thank you for your time. Appreciate you taking time from your vacation. It's always
Thank
a
you, Kelly.
with you. So again, if you all have any questions for Dr. Neugarten, and if you're watching this, if you on YouTube, go ahead and drop in a comment on YouTube. Ask Dr. Neugarten some questions. I'll relay them to him because I'm sure he'll be in surgery the rest of this week, have his week off, even though he's supposed to be on vacation.
I am operating. That's correct.
Because you're changing the world one space and face at a time, impacting lives. But you all know that I always ask the favor of you. Please go on to Apple Podcasts to rate the Dental Handoff with a 5-star rating. Please give us a 5-star. And again, if you're watching this on YouTube, please like, subscribe, and share so the algorithm shares this with everybody you love. And again, Dr. Neugarten, thank you for your time today.
Kelly, thank you. It has been a pleasure, really. I love what you're putting together. I love your charge. It's really a pleasure and amazing. I can't thank you enough.
Thank you. Maybe we'll have you back on for a very specific topic. If you guys want to hear topics from Dr. Neugarten, drop it in. And
my pleasure.
Yeah. And we will see everybody again next week. Sending love. Thanks for all that you do to touch the lives that you do, my friends. See you next time.
Thank you.